There is a statue above the entrance to Los Angeles County General Hospital. It is called the Angel of Mercy. It was placed there in 1933 when the building opened as the largest public hospital west of Chicago. The angel looks down at everyone who enters. It looked down at the wounded soldiers who came back from the Second World War. It looked down at the first AIDS patients in Southern California who had nowhere else to go. And it looked down at the women from East Los Angeles who walked in pregnant and walked out unable to ever have children again. Most of them never knew what had been done to them until it was too late. The story of how this building earned that statue and then betrayed everything it stood for begins in the years before the Great Depression. In the late 1920s, Los Angeles was growing faster than its infrastructure could handle. The county's existing hospital, a modest campus on Mission Road built in 1878, was overwhelmed. Patients were being turned away. People were dying in hallways. The Board of Supervisors decided the solution was not an expansion, it was a monument. They commissioned the Allied Architects Association of Los Angeles, the same group that had designed the Hall of Justice downtown, to build the largest public hospital the Western United States had ever seen. Construction began in 1927. It would take 6 years. The timing could not have been worse. The project started during a boom and finished in the depths of the Depression, because the people who would need this hospital most were the ones the Depression hit hardest. On December 7, 1930, the biggest movie star in the world came to lay the cornerstone. Mary Pickford, America's sweetheart, stood before a crowd and dedicated an 8-ton block of granite to the idea that no person in Los Angeles County should die because they were too poor to see a doctor. 3 years later, the building opened. It was enormous. 19 stories of reinforced concrete rising from a hilltop in what is now the Boyle Heights neighborhood of East Los Angeles. 1 million square feet of hospital space. At the entrance, stone statues of the greatest figures in the history of medicine looked down from their perches. Hippocrates, Pasteur, Galen, Harvey, and above them all, the Angel of Mercy, comforting an infirm couple. Inside, the foyer ceiling was painted with murals by Hugo Ballin, the same artist who decorated the Griffith Observatory. The murals depicted Asclepius, the Greek god of medicine, watching over the healers below. Carved into the building's facade was a promise. The hospital had been erected to care for people without charge, so that no citizen of the county would be deprived of health or life for lack of care and services. That inscription was not decoration, it was a contract, and for decades the building honored it. When the Second World War ended and wounded soldiers flooded back to the West Coast, the hospital expanded to nearly 3,800 beds. When polio struck, the hospital treated thousands. When Los Angeles grew into one of the largest cities on Earth, the hospital grew with it. Millions of people passed through those doors. They were born there. They were healed there. Some of them died there. And the building on the hill became as familiar to the people of East Los Angeles as the freeway that runs past it. One of the people born at the county hospital was a girl named Norma Jean Mortensen. She arrived on June 1st, 1926, in the charity ward of the old campus on Mission Road, 7 years before the new building opened. Her mother could not afford to go anywhere else. That girl would later change her name to Marilyn Monroe and become the most famous woman in America. But in 1926, she was just another baby delivered by a county hospital that existed for people who had nothing. By the 1960s, the campus had grown into a sprawling medical complex, a general hospital, a psychiatric hospital, a pediatric pavilion, a women's and children's hospital. The facility was training more doctors than almost any other hospital in the country. The United States Navy sent its medical personnel there to learn trauma care. The soap opera General Hospital used the building's exterior in its opening credits. making it one of the most recognizable hospitals in the country, even to people who had never set foot in Los Angeles. But something else had changed too. As private insurance expanded and suburban hospitals opened across Southern California, the county hospital became the place you went when you had no other choice. The patients who filled its wards were overwhelmingly poor, overwhelmingly immigrant, and overwhelmingly without alternatives. The hospital was still keeping its promise. It was still treating everyone who walked in. But the people walking in now had something in common that made them vulnerable in a way the builders of this hospital never anticipated. They had no leverage, no political power, no voice. And in a hospital that size, run by that many people, with that little oversight, the absence of power meant that when something went wrong, no one would hear about it. This is one of many institutions where the people who walked in had no power over what happened to them inside. If you know of another one, put it in the comments. Those suggestions directly shape which stories get told on this channel. In 1964, President Lyndon Johnson launched the War on Poverty. Among its many programs were federal family planning initiatives, which directed funding to hospitals and clinics to reduce birth rates in low-income communities. The money flowed based on results. The more procedures a hospital performed, the more federal dollars it received. It was not just Los Angeles. Hospitals across the country were sterilizing poor women, Black women, Native American women under the same funding structure. A federal judge would later estimate that over the course of several years, 100,000 to 150,000 low-income women had been sterilized under these programs nationwide. At Los Angeles County General Hospital, the head of obstetrics and gynecology was Dr. Edward James Quilligan. He had previously chaired the same department at Yale. He was considered a pioneer in maternal-fetal medicine. He was respected, he was powerful, and according to testimony that would later emerge in a federal courtroom, he believed that poor minority women in Los Angeles County were having too many babies, that it was a strain on society, and that sterilization was the answer. Between 1968 and 1974, more than 200 women were sterilized at the hospital. The vast majority were Latina immigrants from the neighborhoods surrounding the medical center. Most of them spoke little or no English. The procedures were tubal ligations performed during or immediately after labor. Consent forms were placed in front of women who were in the middle of giving birth or recovering from emergency cesarean sections. The forms were in English. The women could not read them. Some were told their husbands had already signed the paperwork. That was not true. Some were told the procedure was reversible. It was not. Some were told their welfare benefits would be cut off if they refused. That was a lie. And some were never told anything at all. They discovered what had been done to them only later, when they tried to have more children and could not. One of those women was Dolores Madrigal. In 1973, she gave birth to her second son at the county hospital. Before labor, nurses asked repeatedly if she wanted her tubes tied. She refused. But during the delivery, while she was in pain and vulnerable, she was pressured into agreeing to a procedure she did not fully understand. She went home. She recovered. She did not know what had been done to her. Then, one morning in the fall of 1974, Dolores and her husband Orencio were eating breakfast and listening to a Spanish-language radio station when a news report came on. 100 people had protested outside the county hospital over its practice of sterilizing women without their consent. Dolores looked at her husband and asked the question out loud. Was she one of those women? She went to the hospital to find out. She was. The discovery nearly destroyed her. She later said it was like she went crazy. She could not eat. She could not stop crying. Her husband was furious, not only at the hospital, but at her. The procedure that was supposed to be a medical decision made in her best interest tore her family apart. Not far from the delivery rooms, a young resident named Dr. Bernard Rosenfeld was watching all of this happen. He had arrived at the hospital expecting to learn medicine. Instead, he found himself witnessing what he believed was a systematic campaign to sterilize women who had not given meaningful consent. He began gathering records, quietly and secretly. When he had enough, he went public. The revelation hit the community like a shockwave. Activists, many of them part of the growing Chicano civil rights movement in East Los Angeles, began organizing. 140 women came forward to say they had been sterilized against their will. Protests were held outside the women's hospital. The Committee to Stop Forced Sterilization was formed. And in 1975, 10 women, with Dolores Madrigal's name at the top, filed a federal class action lawsuit against Dr. Quilligan and the hospital. The case was called Madrigal versus Quilligan. Their lawyer was a 26-year-old woman named Antonia Hernandez. She had just graduated from UCLA Law School. She worked out of a storefront legal aid office in Boyle Heights, the same neighborhood many of the plaintiffs called home. She was going up against one of the most powerful medical institutions in the country, backed by the county, the state, and the federal government. She had court documents, the testimony of the women, and the records Rosenfeld had smuggled out of the hospital. 3 years passed before the case went to trial. When it finally did, in 1978, only one person from inside the hospital was willing to testify against the doctors. Her name was Karen Benker. She was a former medical student who had worked alongside Quilligan's team. She told the court that Quilligan had openly discussed his intention to use the hospital's federal funding to reduce the birth rate among Black and Mexican populations in Los Angeles County. She testified that he had said it was good that these women were being sterilized. An anthropologist named Carlos Vélez Ibanez also testified for the plaintiffs. He argued that for Mexican women, motherhood was not simply a personal choice. It was central to their identity, their family structure, and their culture. Sterilizing these women without their understanding or consent was not just a medical violation. It was, in his words, a form of cultural sterilization. It did not just take away their ability to have children. It took away a part of who they were. The hospital's defense was straightforward. Every consent was voluntary. Every procedure was medically appropriate. No woman had been forced to do anything against her will. The judge, Jesse Curtis, listened to all of it, and then he ruled in favor of the hospital. He called the sterilizations a result of miscommunication and language barriers between the patients and the doctors. He wrote that the physicians had acted in what they believed was the best interest of the women. He stated that it was not objectionable for a doctor to believe that sterilization could help diminish what he perceived as overpopulation, as long as that doctor did not overpower the will of his patients. The 10 women lost the case. But what happened next is the part of this story that no one expected. The Madrigal case lost in court, but won everywhere else. The public attention generated by the trial forced California to implement sweeping reforms. Consent forms for sterilization procedures were now required to be bilingual. A mandatory 72-hour waiting period was established between signing consent and undergoing the operation. It became illegal to approach a woman about sterilization while she was in labor. Patients under 21 were given additional protections, and every form had to include a clear statement that refusing the procedure would have no effect on welfare benefits. California had maintained a eugenics law on its books since 1909. Under that law, more than 20,000 people in state institutions had been sterilized over 7 decades. California had performed more forced sterilizations than any other state in the country by a wide margin. In 1979, largely because of the attention the Madrigal case had brought to sterilization abuse, the state finally repealed that law. Antonia Hernandez went on to become the president of the Mexican-American Legal Defense and Educational Fund. The storefront lawyer from Boyle Heights became one of the most influential civil rights attorneys in the country. The women who lost their case had changed the law more than most people who win. It took decades, but the institution eventually acknowledged what it had done. In 2018, the Los Angeles County Board of Supervisors formally apologized to every woman who had been forcibly sterilized at the hospital. 4 years later, a monument bearing the names of the women was dedicated on the hospital grounds. The case is now taught in universities across the country as a landmark in reproductive justice. Dolores Madrigal lived long enough to see all of it. She died in Las Vegas on November 9, 2024, at the age of 90. She was survived by 2 sons and 4 grandchildren. At the time of her death, her granddaughter Andrea was expecting her first child. The woman who had her ability to bear children taken from her without her knowledge lived to see the next generation of her family continue. The hospital did not close after the scandal. It did not transform either. There was no institutional reckoning, no purge of leadership, no public accounting beyond the reforms the lawsuit had forced. The hospital simply kept operating. The community still had nowhere else to go. That was the trap. It had always been the trap, and within a few years, a new crisis proved just how inescapable it was. In the early 1980s, a mysterious illness began killing young men in Los Angeles. The first federal warning, issued in June of 1981, described 5 cases of a rare pneumonia in gay men in the city. It would become the AIDS epidemic. Los Angeles County General Hospital, once again, became the place where people went when no one else would treat them. The hospital eventually operated one of the oldest and largest HIV clinics in the country, caring for roughly half of all AIDS patients in Southern California. Activists with ACT UP Los Angeles marched outside the building, demanding faster research and better treatment. The same institution that had violated the rights of its patients a decade earlier was now the only place many of them could turn. The building absorbed it all. That was what it did. Crisis after crisis, decade after decade, the great stone mother on the hilltop took in whoever showed up. Then, on January 17, 1994, the ground moved. The Northridge earthquake struck the San Fernando Valley at 4:31 in the morning. The damage was catastrophic across Los Angeles. The 1933 hospital building, designed long before modern seismic codes existed, sustained serious structural damage. New state legislation required hospitals to meet updated earthquake safety standards or close. The old General Hospital could not be economically retrofitted to comply. A replacement facility was planned and funded. Construction cost more than $600 million. The new hospital opened in 2008, directly adjacent to the old one. One by one, patients and staff moved to the new building, and the old one was emptied. For nearly 2 decades now, the Great Stone Mother has sat vacant. 19 stories of frozen time, visible from the 5 freeway and from airplanes descending into LAX. Inside, surgery theaters sit untouched. A prison hospital ward remains sealed. Gurneys line corridors where no one walks. The Hugo Ballin murals of Asclepius still cover the foyer ceiling. The statues of Hippocrates and Pasteur still guard the entrance, and the Angel of Mercy is still there, looking down at doors that no longer open. But the community that depended on this building for 145 years refused to let it be torn down. After a decade of planning, community meetings, and feasibility studies, Los Angeles County approved a $1 billion adaptive reuse project in 2023. The old General Hospital will be converted into 885 units of housing, at least a quarter of them affordable. The plans include mental health treatment beds, medical offices, retail space, and community services. The developers have committed to preserving the historic elements of the building, the tile floors, the large windows, the Art Deco detailing that made it a landmark. In September of 2025, nearly 900 people walked through the empty halls on a Los Angeles Conservancy tour. They saw the surgery theaters. They saw the sealed wards. They saw a building that had held more lives inside it than most cities. Supervisor Hilda Solis, who had championed the project for years, said something that captured the weight of what this building carries. "There is history there," she said, "whether it is good, bad, or indifferent." The inscription is still on the facade, erected to care for people without charge, in order that no citizen of the county shall be deprived of health or life for lack of such care and services. For decades, the building kept that promise. Then it broke it. Then it was broken itself. Now it is about to become something new. Whether it can live up to the words carved into its own entrance is a question that will not be answered for years. If this story stayed with you, let me know in the comments what part of it hit you the hardest. The angel of mercy is still above the door, still looking down, still waiting to see what happens next.